Hello, my name is Emma Grina, and welcome back to the Daily News. Today's segment is going to be on the occurrence of HIV in injection drug users in the United States, otherwise known as IDUs. According to Center for Disease Control and Prevention, 1 in 5 IDUs worldwide is infected with HIV, and currently 12% of AIDS cases in those ages 50 and older are due to injection drug use. In 2015, 2,392 out of the 39,513 diagnosed with HIV in the United States were attributed to injection drug use. 59% were men, and 41% were women. 38% were African Americans, 40% were Caucasians, and 19% were Hispanic or Latino. Of those diagnosed, 82% of males and 83% of females were linked to care within 3 months of their diagnosis. The reason for HIV being so common among the injection drug users is due to the sharing of needles. Sharing needles is very common among injection drug users since it is not super easy to get fresh needles and it can be very costly.
Hi, I'm Katie and I'm going to be telling you about the 4 P's of social marketing in relation to HIV. Social marketing is a carefully planned, long-term approach to changing human behavior. It is used to promote an increase in knowledge, behavior change, and social change. Social marketers promote socially beneficial behavior change rather than commercial products and services. Social marketing programs do not operate in a vacuum. Government support is a key component of a successful program. For example, in IDU treatment, it is crucial that the government supports this treatment. The 4 P's of a conceptual framework views the consumer as the center of an exchange process in which she or he is acting primarily out of self-interest, attempting to maximize their ability to satisfy wants and needs and minimize what they must sacrifice to obtain them. Here are the 4 P's of social marketing. First is product. The health behavior being promoted and its competition/problem. The role of research here is to discover the consumer's perceptions of the problem and the product, and to determine how important they feel it is to take action against the problem. The next P is price. Price refers to what the consumer must do in order to obtain the product. This includes social, emotional, and monetary costs in exchange for the product's benefits. Time, effort, embarrassment, loss of pride and dignity, and the physiological discomfort associated with change, especially in lifelong habits. If the cost outweighs the benefit for an individual, the perceived value of the offering will be low and it will be unlikely to be adopted. However, if the benefits are perceived as greater than the costs, chances of the trial and adoption of the product is much greater. The next P is for place. Place is described as the way that the product reaches the consumer, where the exchange takes place, and/or where the target behavior is practiced. For example, relating to IDU treatment, this would be a doctor's office or a medical research group. The last P is to be discussed is promotion. Promotion is activities used to facilitate that exchange. The focus is on creating and sustaining demand for the product. Research is crucial to determine the most effective and efficient vehicles to reach the target audience and increase demand. Thank you.
Hello, my name is Harley. I'm going to be discussing the resources available, the access to resources, and the challenges to treat those who suffer from injection drug use, also known as IDU. While trying to treat the drug user, one can use either the harm reduction model or the abstinence-oriented perspective. The harm reduction model is a community-based public health intervention that provides support and health promotion services to drug users without the requirement that they remain drug-free. It aims to reduce the negative consequences of drug use by reducing the harm self-inflicted by the user through unsafe practices. Now, the abstinence-oriented perspective requires the IDU must first be detoxified of the substances and then taught healthier coping mechanisms. Approximately 10% of drug-using population enter detox programs, and then the 90% include those who cannot participate because either of the lack of space, lack of financial resources, or they do not wish to detox. This model is an all or nothing approach that produces more failures than it does success. There are a few different types of the harm reduction approaches that are available for people. Maintenance therapy or drug substitution treatment, safer injection facilities, having pharmacies sell syringes, community-based outreach programs, and then needle exchange programs. Many injection drug users who would otherwise have no contact with any health services are attracted by these programs, which then act as gateways to other services, including primary health care, HIV testing, antiretroviral therapy, and services for tuberculosis, hepatitis C, and sexually transmitted infections. Effective programs are based on the understanding the extent of injection drug use in the community, who is injecting the drugs, which drugs are being used, and the key risk behaviors among persons who inject drugs, PWID. The programs distribute clean equipment, promote safe sex, and provide information about prevention and rehabilitation. Some programs use past drug users who have become clean to teach current drug abusers a safer route, how to go about it. To be most effective, harm reduction must encompass policy change as well. Such changes can be accomplished by building multi-sector alliances to increase access to harm reduction services and additional treatment services that use harm reduction approach. Now, there are many challenges associated with treating those who suffer from IDU. Government support is a big key component of a successful program. Drug abusers face many challenges in gaining access to health care, including distrust of the healthcare system, cost of treatment, poor adherence to treatment, and potential reinfection from injection drug use. IDUs or HIV-infected patients are less likely to receive pre-therapeutic evaluation, as well as appropriate antiviral therapy, even after evaluation when they are compared to others. Stigma and discrimination are associated with illicit substance use. Often, IDU is viewed as a criminal activity rather than a medical issue that requires counseling or rehabilitation. Stigma and mistrust of the healthcare system may prevent PWID from seeking HIV testing, care, and treatment. In a study of cities with high levels of HIV, 51% of HIV-positive PWID reported being homeless, 30% reported being incarcerated, and 20% reported having no health insurance in the past 12 months. Now, IUD does cause other diseases and complications, like the risk of HIV and other bloodborne and sexually transmitted diseases, such as viral hepatitis. They can also get other serious health problems like skin infections, abscesses, or even infections of the heart. People can also overdose and get very sick, even die from IDU.